Today we're going to talk about walking out your patient. When you've had your patient in the chair at the end of treatment, you need to walk your patient out in the computer and fill out the patient's route slip. This video is only going to show you how to walk out your patient on the computer. There are several ways to get into the patient's account, but while you're in your operatory, you will most likely have clicked on your patient's name from the schedule and been working within the EagleSoft program from there. From the schedule, if you click on your patient and click on this button that says Account up in the corner, it brings up your patient's account. Right here, this is the screen that is open. You need to click on the button next to it that says Walked Out. Sometimes things may pop up. This is a test patient. We use it a lot to show examples. If this screen pops up, just X out. This is where you're going to enter the procedures that were performed during this clinic session. If it is your patient's very first time to clinic, and you are in your very first semester as a dental hygiene student, you are in 71B. So when your patient comes to their very first clinic appointment with you, you are going to be entering 71B as their initial appointment. You click in the box under Service and just start typing 71. A drop-down list will pop up as you enter numbers or letters into the service box. 71B, Initial Appointment, is the service you will walk out for your patient's first appointment to clinic with you. When they have been screened, approved by your faculty, and you were to come to reception to get a chart, that is the clinic session that you will enter 71B, Initial Appointment, as the walkout. You only do the initial appointment once, only the first time your patient comes into the clinic to be seen by you. All additional appointments, there will be other items entered into the walkout. You will not repeat the initial appointment. After you've entered the service, it's very important that you provide the EagleSoft program who you are. Otherwise, you will not get credit within the program for the services provided by you. You click on the drop-down list, and you can type in the first letter of your first name, and it will bring up a drop-down list so you can enter your name. If you forget, it may stay under the word Security Administrator, and Security Administrator will be getting credit for that service, and you don't want that to happen. So make sure that you enter your name under Provider. If you were to need to enter another service during this appointment, you can click here under Add Service, and it will bring up the next line, and you would just start entering the next service. Since this is our patient's first appointment in 71B, 9 times out of 10, this is the only thing you will be entering for the walkout for that very first appointment. Once you have entered 71B and Security Administrator, you can hit Save, and it will ask you if you'd like to process this walkout. You say yes. Nothing shows up here under the walkout screen, but that's okay. To check to make sure that you have entered your procedures correctly, go back to the Account tab at the bottom of the screen. Look for the date. I happen to be doing this video on April 19th, 2019. I put in the provider as Security Administrator, and the service was 71B, Initial Appointment. That's how you can tell that you entered your walkout correctly. Then you can close out, or you can go back to walkout, and close out from there. If you notice on the schedule, this appointment before we did the walkout was the color pink. After you do a walkout, your patient's name on the schedule will appear in this gray color. That indicates that your patient has been successfully walked out for that day.